The following is a paid program sponsored by Schaefer Eye Center.
The science of seeing better goes well beyond just an ordinary eye exam. At Schaefer Eye Center, our doctors and vision specialists use the latest in advanced diagnostic equipment to not only make sure your eyes are healthy, but that you are too. Of course, we can detect all the things you expect, like glaucoma, macular degeneration, and ocular hypertension, but also many things you wouldn't expect, like early indicators of more serious health conditions like diabetes and even brain tumors. Hi, I'm here at the new Schaefer Eye Center with my new friend, I guess new after 2 years, but this is Mr. Stephen Allen, lead architect from Williams Blackstock, that planned, developed this whole facility with me. And so first of all, thank you very much. You bet. We absolutely love it here. So when you first walked in this building, when I took you here, what were your thoughts?
Well, it's such a large building. I was at first a little flummoxed as to why would you be selling eyeglasses and eyewear and patient care in such a large building. But after talking with you further about it, I realized you've got a real vision about creating a whole experience and enhancing the Schaefer Eye Center experience, and that this building was a huge canvas for you to do that. So that was really exciting.
Well, you captured my vision, my dream, and
Thank
all
you.
of our dreams. When it was done, because I have a hard time picturing things finished. I just knew what I wanted. When it was done, other than the fact that I wanted everything white, when you walked in, what did you think of the finished product?
Oh, I continue to be astounded and amazed. And really I feel like we were a vehicle for your vision and for all of your staff's vision. I hope that it really creates that unique opportunity, that unique environment that you're seeking, that is a little bit unique just to you, but it's also very much caters to the patients. You talk a lot about, I was taken by your talk about science, service, and style, and I think that's important, and I'll leave the science to you. I think you're probably much more suited for that. But the service and style, I think we tried to embody that and create a place that is about service, but also speaks very much to your style and to the opportunities of style that you provide for your patients.
And again, I say when you come see the facility, you feel it. You walk in, we made the waiting room comfortable, so you're separated, but yet you can see what's happening. You made the optical into a trip down New York or LA, as we call our runway. And then, of course, the key part, the clinical area, is set up so we can efficiently see the patients with all the special equipment. So literally, my vision has been accomplished for this, and I can't wait to see the rest, and just officially for all of Schaefer Eye Center, thank you very much.
Thank you.
And y'all come visit. You can't believe what we've done. Welcome to the new Schaefer Eye Center. I'm so excited for our whole team at Schaefer Eye Center at our new flagship office in Hoover. This is where I started practicing, and this is where we built the prototype of what you're going to see in all of our Schaefer Eye Centers. Schaefer Eye Center is about science. That's taking care of your eyes for a lifetime with a great eye exam. We're about style, and this is style. Visit our runway and all the different optical options you're going to have, with the most fashionable frames to the most basic frames and every lens technology you can imagine. And we're about service. Service is about taking care of you, but also taking care of the city of Birmingham, of being a partner. We've been part of Birmingham for over 30 years, and with all of our employees and all of our doctors, I welcome you to the new Schaefer Eye Center. So let's start with a tour. A tour of Schaefer Eye Center starts with an eye exam. So follow me as I take my suit off, put on my white coat and take you through what's going to happen at the highest level of eye care that you're going to find.
Evolution is a constant. It knows only one direction: forward. Hey! Advancing, adapting, modifying, learning from every moment, every experience to transform right now into what's next. Because vision is evolving. Are you?
An eye exam starts with a comprehensive workup, and the staff at Schaefer Eye Center are here for you. They are wonderful at what they do, and they make sure we as doctors get all the information we need before we even start your eye exam. And it starts with the OptiMap. We make sure we have the picture of the entire retina when you come into the exam room, so we know about your medical history and your retina. Next is your glasses. We want to make sure your glasses and contact lenses are perfect. And at Schaefer Eye Center, we start with computerized equipment to give us a great start. But we promise you this, at Schaefer Eye Center, the doctor himself will find out if your prescription is accurate. We don't use any extras. We use doctors to make sure your prescription is just right. Next is visual fields. You never know if there's something wrong with your peripheral vision. So at Schaefer Eye Center, we start with the Zeiss screening to make sure that anything out in your periphery that's causing any changes is measured and watched. We know that nearsighted people, sometimes up to 12%, have a visual field defect, and it's very nice to know that before we start the eye exam. Next is the lippy view. We will talk about this more about dry eye, but we also may look at your tears and see how thick the tear layer is. This is the only piece of equipment like this in the state of Alabama. And again, to our newest and greatest invention, and that's called the ClearPath Diabetic Screener. Without taking any blood out of your system, we can take a picture of your eye and tell you if your blood sugar is where it should be, and if there's something we should be looking at, whether it be diabetes or pre-diabetes, before you'd ever know. At Schaefer Eye Center, this is how it starts. Now that you have completed your workup, the doctors will see you in one of our multiple exam rooms in this wonderful clinical area. We are really enjoying the pleasure of the space and all the latest in ophthalmic equipment to examine your eyes. So now you've completed your workup, the doctors have examined your eye, and now you're in our favorite rooms. We have 2 complete medical testing rooms for those that have medical issues: macular degeneration, glaucoma, hypertension, diabetes. We have to monitor this and make sure that we're taking care of you so you will see for a lifetime. So we start with a retinal photograph. This happens to be a picture of someone that has a genetic disorder. And we watch that also, just like everything else, because in today's time, we can see so much when we can monitor you not only with our eyes, but 3 different types of retinal cameras. Next, we go to the OCT. So we talked about, first of all, people have macular disease, macular degeneration, glaucoma, but also a key today is floaters and flashes. If you do have flashes and floaters, get in immediately for an eye exam, because here's a patient that, Dr. Mark Schaefer, you want to tell us what you're seeing here?
What we're seeing here is in the central part of your vision, which is your best area of vision. We see some elevation here that's actually causing this patient to have decreased vision.
And this is due to pulling on the eye from the vitreous that because of floaters and the vitreous coming forward. But a lot of this we couldn't see in the past, and we know this is treatable. If we treat it fast, you will not have to lose your vision. Next is one of our key tests, and this helps us diagnose macular degeneration earlier and any changes. Those are called PHP. And what it does is if we see a change in the macula, through this we know that you're starting to go from a dry to a wet AMD, and we want to get that quickly because today we can stop that degeneration. Again, the medical testing at Schaefer Eye Center is what separates us from the rest. The science of seeing better goes well beyond just an ordinary eye exam. At Schaefer Eye Center, our doctors and vision specialists use the latest in advanced diagnostic equipment to not only make sure your eyes are healthy, but that you are too. Of course, we can detect all the things you expect, like glaucoma, macular degeneration, and ocular hypertension, but also many things you wouldn't expect, like early indicators of more serious health conditions like diabetes and even brain tumors. Perfect vision. The freedom from wearing contacts or glasses can be yours with Schaefer Laser Vision. We helped pioneer the use of LASIK surgery in Birmingham over 20 years ago, and our own Dr. Jonathan Wilson has performed over 80,000 surgeries, including more than 300 eye doctors. Just imagine being able to see well into the future without wearing contacts or glasses. At Schaefer Eye Center, our new children's optical is just phenomenal. It's so much fun. Kids like these are just having a great time. Foster, what do you think? You love trying on glasses? It's so much fun. How about it, Edith? Show us a great pair. And Edith will show you that kids can just have a great time. We have such a great selection because, again, children love the coolness today. They love the colors. And Maddie, what do you think of your yellow glasses? They love them. Again, at Schaefer Eye Center, we're not just about style for adults. We're about making children happy. We've talked about Schaefer Eye Center, our new children's initiative. Contact lenses are the most important thing that you can do with contacts and make sure that our children take care of their eyes for a lifetime. Emma Kate is a contact lens wearer. So not only do we have great technicians like Alex here that is training her how to put the lenses in and out, which is really the simple part, it's also how they take care of the lens. We know that children have the most problems of all demographics due to corneal ulcers, infections, and just not taking proper care of the lens. That's why we see all children every 6 months. Schaefer Eye Center has a rule: if a child wears contacts, anybody under 16, they will be seen every 6 months, so we make sure they're taking good care of the lenses, right?
Yes, sir.
And we make sure that you love your contacts, don't
Yes,
you?
sir.
And we saw Emma Kay trying on glasses because all children that wear contacts should be wearing glasses. Now when we go in the exam room, we're going to talk about nearsightedness and children controlling that nearsightedness. If we fit the child properly and the right kind of contacts, there are studies now that shows that we can stop their nearsightedness by up to 40%. That's what I said. 40% reduction in nearsightedness just by wearing the right kind of contacts. So that's you, Emma Kate. Well, you're not going to be nearsighted anymore, right? And then when she does, we'll fix her with laser surgery. Isn't that right?
Yes, sir.
Yes. No matter who you are, the Schaefer Contact Lens Center of Excellence will provide you with healthy, accurate, and comfortable vision. Bad habits like oversleeping in your contact lenses are a major cause of infection and vision loss. Our doctors are contact lens experts. We will ensure the safety of your vision. Young people in contacts are at a high risk for complications. We will be your ongoing partner in their vision care. We take your child's eye health seriously. If you are wearing monovision contacts, one for reading and one for distance, a better option is multifocal lenses. Your vision needs evolve over time, but you deserve precise, effortless vision. If your eyes hurt by the end of the day, you could suffer from dry eye syndrome. Using the latest medical technology, our doctors will customize your treatment to give you clear, comfortable vision. Trust in the expert care at Schaefer Eye Center. At Schaefer Eye Center, we've talked about the Children's Initiative, and people ask us all the time, how old should I be to have an eye exam? So Maddie, how old are you? 2? 2.5? Yeah, how about that? 2.5 is a good age to start. But what about an infant? Because we have something called infancy. If you have a child that is under 6 months of age, an eye exam is free because we like to know how their vision is from that age to make sure that they are seeing well. Actually, Dr. Kaplan's under 12, right?
Under 12, 6 to 12 months.
6 to 12 months of age. Edith, how old are you?
7.
7, and she's had an eye exam because when you enter the first grade, is that what you're in first grade? You have to have an eye exam to know how you're going to compete in school and make sure you see well. And McKay, how old are you?
12.
12. Are you driving yet?
Yes, sir.
No, I don't think so. But I know you've had a lot of eye exams, right? Because her father's a doctor at Schaefer Eye Center. And Foster, how old are you?
11.
11, and she's had lots of eye exams because her mother is a manager at Schaefer Eye Center. So we have all the families. Dr. Kaplan is looking at Foster's eyes and McKay. And I want to thank y'all for being part of this whole children's program. Again, I explained this earlier when we were talking about contacts, but every one of these children have a good chance they're going to be nearsighted. And we know today, with special programs at Schaefer Eye Center, we can slow down that nearsightedness. And this has started at the University of Houston and now moved to Australia, and soon at Schaefer Eye Center, because we have programs that will hopefully help your child have a 40% reduction in nearsightedness as they get older. And it's not just about less nearsightedness. When they get older, less glaucoma, less retinal detachments, less medical problems, because we started at this age to make sure you're wearing the right contacts and the right glasses. Again, thank you for watching, and thank you, everybody. Wave to your friends. Say goodbye. Of course, you already know Schaefer Eye Center is the destination for designer eyewear. Cartier, David Yurman, Sama, Robert Mark, Barton Pereira, Salt, Oliver Peoples, and many, many more. With over 3,300 frames available, we can help you find the perfect pair for your individual needs, style, and budget. You've now completed your eye exam. We have the right prescription, and now it's time to have fun. It's time for the Schaefer Eyewear Experience. And we're going to take you to our runway, and we call this the runway because it's about fashion. You know, if you're in New York or Los Angeles, the key brands all have their own optical shops on every corner of Madison Avenue, Fifth Avenue, Soho, and of course Rodeo Drive. At Schaefer Eye Center, we brought that all under one roof just for you. And we start with two favorite designers, LA Works and Anna Valentine. Both unique shops, unique designers around the country. As you go through what we call our style suites, we start on your left with Robert Mark. Robert Mark has multiple stores all over the country, including almost 5 on Madison Avenue. But at Schaefer Eye Center, again, we have the Robert Mark suite. To the right here, you see the Sama suite. Sama, one of our favorite designers. Sheila and Ross are great friends and just wonderful people. Next, we have Barton Pereira. Later, you're going to hear from the president of Barton Pereira, Billy Barton, who happens to be visiting today, and he's going to tell you a little bit about the new Schaefer Eye Center. But again, Patty is one of the best designers of eyewear in the country today. To your left here, we have Oliver Peoples. Again, Oliver Peoples is one of the first people to start the new coolness of eyewear. And to the right here, we have Salt, again, one of our favorite brands. They like to think of their real cool brand with no names and just a clean, nice look. And again, the suites keep going. We have Judith Lieber, David German, Tom Ford. You name the brand, it's available here at Schaefer Eye Center. But I also bring you to the normal Schaefer Eye Center, and this is where you see all the glasses that you see in every optical throughout the city. And why do we have these? We make sure we have whatever you need. You know, when you have insurance and you say, I want my glasses paid 100%, we have over 200 pair of glasses that you can get paid 100% with your insurance. But let's say you just want to spend a little bit more. We take some of our best brands, and every few months we'll put them on the boards and allow you to buy the best, most expensive glasses for less than $100 with your insurance. Again, at Schaefer Eye Center, we're here to serve you. Whether you want the highest style and some of the best products in the country like Cartier, or you want something that's more budget but high quality, at Schaefer Eye Center, we are listening to you and we have what you need. You know, we've talked about the Schaefer Suites and the new flagship Schaefer Eye Center, and I'm here with one of my closest, oldest friends in the optical business, who we are officially today naming the Barton Pereira Suite, since he is Mr. Billy Barton, president of Barton Pereira. And I know Patty, we love you. She's really the brains, right? Not you.
There's no question. Patty is the secret sauce to the Barton Pereira formula.
But we have the whole Barton Pereira team right here with us, Axel and Celeste, and I've known that forever. But Billy, what do you think of the new office?
It's, you know, you go all over the world, because I do go all over the world, and this, I've never seen anything like it. It's amazing.
Well,
It's well done.
Well, you know, it is a great place to house your frames. You know, I know Billy is so proud of the stuff he's done, and so have I. Know you've been at Oliver Peoples, Chrome Hearts, you've done everything, and you've really made a difference. And first of all, I want to thank you, and this is the official raising. If y'all would raise it up for me, because this is your new suite, the Barton Pereira Suite at Schaefer Eye Center.
Well, we couldn't be happier. Thank you.
Of course, you already know Schaefer Eye Center is the destination for designer eyewear. Cartier, David Yurman, Sama, Robert Mark, Barton Pereira, Salt, Oliver Peoples, and many, many more. With over 3,300 frames available, we can help you find the perfect pair for your individual needs, style, and budget. The Schaefer Eye Center experience is all about you, but it begins with our people. Our doctors and vision specialists are committed to giving you the best in comprehensive eye care. Whether it's your regular exam, new frames, LASIK surgery, dry eye treatment, finding the right contact lens, or even helping you navigating your insurance options, everyone at Schaefer Eye Center is focused on one thing: giving you clear, comfortable vision. Are you ready to evolve your eyes? Experience it for yourself. Visit Schaefer Eye Center today. Well, I'm here today at the new Schaefer Eye Center with one of my best friends, one of the best doctors in Birmingham, definitely best orthopedic, Dr. Larry Lemak. We're here today talking about things that you do, and I know you do so much. But I witnessed Larry setting up a screening program for all 5,000 athletes in multiple high schools throughout the city to make sure that we have good eyes, that was my job, knees, lungs, heart. How'd you get started doing that? I know it's Lemak Sports Medicine, but how'd you get that organized?
Well, part of sports is a pre-participation physical. Whether you're at high school, collegiate, or professional sports, you have to have a pre-participation physical every year. So that's just part of the routine. It's a law in Alabama for the High School Athletic Association that you cannot go on the field until you have a pre-participation physical exam. And it can be a very good exam, or it can be very just a quick exam that somebody signs off on. But we do a very comprehensive screening on these athletes because there's all kind of concerns about underlying heart conditions, diabetes, any problems of blood pressure, or knee problems, shoulder problems, the things that as sports medicine surgeons we are worried about quite a bit. So we evaluate the athletes, and then thanks to our relationship and you and I talking over the years, we've added a baseline concussion screening this year for the first time into our pre-participation physical exam.
And I do want to say, because again, watching this happen, it was just so amazing, because I know your team is great. We've met all your physicians. You know, during bringing in the concussions, we've had to train your trainers. We're going to talk about that in a minute. But I still want to talk about those physicals, because again, I know you do so much for the city. And I know a lot of high schools use this as a fundraiser, but I know it's not a fundraiser for you, and you donate the time of all your facilities and all the staff to make sure that's good. So I do want to thank you for doing that. We have added something called the King-Devick test. Now, Dr. Devick is a friend, and he invented this test years ago, but he found out that we can diagnose concussions on the sideline training the trainers. And I want to thank you. I know you've allowed us to bring this test in. Actually, you promoted it. And now, when your child's playing football, or at this point, any sport, that we have a baseline of what they are mentally through this King-Devick test. And if they have an injury on the sideline, I know the law that you established is they have to be taken out of the game anyway. But now we can actually measure them with some simple numbers. It takes less than 3 minutes to do this test, and the trainers can actually determine where are they mentally right then on the field. Then after they see one of the physicians, the Lemak physicians, we test them a week later and 2 weeks later to make sure they're ready to go back into play.
Yeah, this is a great process, Jack, because for concussions, you have to have the baseline testing. Concussion evaluation is very important to know where they were to determine where they are today, and you can't do that unless you have the baseline. Now, thanks to you, we provide the baseline testing. You've trained our athletic trainers how to do the test. We've entered all the baseline testing on their iPads so that they can look at the athlete when he comes off the field. They can compare it to his baseline testing and see that, in fact, that he has some changes in what we call cognitive knowledge, where his mind is working properly. So now we can do that, and we have 4 primary care sports medicine physicians in our group who are educated and experts in concussion evaluation and treatment. So we use the King-Devick not only for testing them on the sidelines, but for the return to play, things like return to learn, which is important too. An athlete can't go back to using their brain just like they can't go back to using their knee when it's injured until it's ready. So this allows us to determine all that.
And the other part to this is going to be performance, because I know Dr. Lemak and I are working on not just how we get people that have concussions, but what are we doing after the fact to get them back faster. So we know that after 2 weeks, if you aren't back to totally normal measured by the King-Devick, we actually have a therapy program. We can take those kids and move them quicker so they can get back into a learning process again, because sometimes it can take months if they really have a bad concussion.
And you have to return them safely to play too, and that's the whole key, and that's why this is so important, because this allows us to test them along and see where their brain is and evaluate their brain. One of the problems with concussion testing, it's a gray area. There's not a lot of hard information, where King-Devick now gives us a way to measure it and get some what we call subjective data on these athletes, and we can use that to safely return kids to play, because one of the things that we've learned over the years, and especially with all this focus on concussion, is that they were sending athletes back over the years, and this is all common knowledge now with the NFL and all the problems they've had, sending athletes back to play before they were ready. Now we have a test that says, well, this is where you were, you're not there yet, so let's not return you to play until we can return you to play safely. Everybody wants to get back to play, but getting back to play safely is the real key.
Yeah, and I do appreciate everything you're doing for the city, for me, for Schaefer Eye Center, for all of us. So thank you again and again. The Lemak Sports Medicine Group and the Schaefer Eye Center Group, our new concussion initiative, and we'll be right back. At Schaefer Eye Center, we are about taking care of your eyes.
The preceding paid program was sponsored by Schaefer Eye Center,